was great. Now let's move on to item number 9, which is the COVID-19 staff update. Okay, looks like we've got everybody on board. Marilyn, do you want to kick us off? And you're muted.
Thank you. I will definitely kick us off. We remain in the yellow tier. We've had a couple of cases last week and likely to report one today, but the case rate that remains low, which is great. And we are preparing to move beyond reporting yellow tier and moving beyond the blueprint for a safer economy as of next week. It sounds like we're still on target to, to remove many of the restrictions on our businesses and to align our guidance a little bit more with the CDC beginning next week. But there's still a lot that's unknown. And, the governor is not rescinding the emergency declaration, but we do anticipate some changes next week. But I will be honest to let you know that there are still some unknowns to our, and a lack of clarity around some issues. And we're hoping over the next couple of days to next week that we'll have more clarity from the state on those kinds of issues like face coverings, that type of thing. Anna's going to provide you a little bit more information on vaccines and that are coming up and our rate of vaccination and just some general information. So I'm going to turn it over to you, Anna.
Thank you, Marilyn. Yes, just a quick update on vaccine coverage. We are currently in Inyo County at a coverage rate of 64%. So that's the percentage of Inyo County residents who've received at least one vaccine. We're a little over 54% fully vaccinated. So we're tracking real close to what the statewide numbers are for that. In California, we're at just under 66% coverage rate with 53.7% fully vaccinated. So just a little bit ahead on the fully vaccinated rates. We do have two, from the Inyo County public health perspective, 2 second dose clinics for Pfizer this week. So we'll be adding some additional fully vaccinated individuals to our numbers this week. Tomorrow we'll be at the Bishop Senior Center doing a second dose clinic in the evening from 5 to 6:30 p.m. and again at Bishop Senior Center, and that clinic is fully booked. So those are second doses from our last mass vax clinic at the fairgrounds where we provided the first dose, expansion of the first dose availability that weekend. So we'll be doing that tomorrow evening, and then back down in Lone Pine on Thursday, we'll be doing a second dose clinic at Statham Hall from 1 to 3. Again, that one is booked at this point, and we have a second dose clinic expected for that day. We're also going to be at the Lone Pine Wellness Center and coordinating with our behavioral health colleagues to provide some additional vaccine at the Wellness Center that day. So those are our upcoming clinics from a public health perspective. We are continuing to refine and support redistribution of the Pfizer vaccine to other providers in the area so that Pfizer is regularly available. Again, that is the vaccine that is currently approved for ages 12 and over. The other 2 vaccines are also available in the community, the Moderna and the Janssen vaccine. Those are both approved at this point for 18 and older. We'll continue to monitor to see whether we are expecting, as the clinical trials continue, that both of those eventually will be approved for those younger adolescent age groups as well through perhaps in the summer or early fall, and we'll continue to monitor that. And That's what I have right now for vaccine updates. Please visit the Inyo County website. On there, we will continue to maintain an updated list of the different providers in the area, how to make appointments for vaccine, and where you can go to get your first and second dose of vaccine going forward.
Okay, great. Dr. Richardson, do you have anything to add?
Jeff,
And
I couldn't
I don't
understand
believe,
what you said.
I'm sorry, I don't believe Dr. Richardson had anything additional today, but wanted to be available if there were questions that came up that required a medical perspective as
Okay, great. Do any of the supervisors have any questions or comments?
It sounds like the next thing is going to be the OSHA guidelines and how they match up with our state or federal guidelines otherwise. Is that true? We're sort of waiting on that as far as how at least as far as the county going back to work and probably other workplaces also.
Yes, right now what we're expecting is that next week, CDPH has indicated that they're planning to issue updated masking guidance that aligns with the CDC guidance currently in place for vaccinated individuals. We are monitoring. Cal OSHA continues to work through their emergency regulations. We had a ruling last week that recognized that fully vaccinated individuals may not be required to wear their face coverings indoors, but because people at work are subject to, in a variety of settings, are subject to a more constant interactions with others, there are still some restrictions in place from the Cal OSHA perspective. So they're continuing to meet. There's another meeting tomorrow, trying to get that those guidelines aligned, and that's part of when Marilyn referred to still some uncertainty. Those are still some conversations that are happening and some action that we're expecting to continue to monitor and hear more about through this week and into next.
Are we expecting that people will be carrying their vaccination cards? I mean, in other words, thinking about our workforce, and are they going to be, well, and I'm even trying to think about whether do I need to be carrying that with me traveling or not, or even just all the time?
Right now, from a business owner perspective, depending on where the final Cal OSHA rules land, there will be some requirement for businesses to establish if they're not requiring face coverings in the workplace, that they have a process in place for verifying vaccine status for employees. I believe at this point that's through a self-attestation or through viewing the vaccine card. We don't expect that, to be able to go to the grocery store, into businesses in general, that there will be any requirement to show your card. Now, you mentioned travel. There could continue to be requirements, especially for international travel, to verify vaccine status, and that will be largely dependent on where you're traveling to. Aside from that, as of next week, once most of the blueprint guidance goes away, the place where there will still be some requirement for verification of vaccine status would be for the very, very large events, the mega events that are either very large, over 5,000 people indoors, or over 10,000 people outdoors, where there are still some requirements for either testing or proof of vaccine.
Great, thanks for that. Yeah.
So I had a question. It's actually been something I've been thinking about a bit. I did get a call from a constituent whose child has type 1 diabetes and is vulnerable to if they do get the disease, but they also they can't get the vaccine because of their medical status. And there was some confusion and concern about what the masking guidelines are indoors, and how Inyo County lifted the local order, but the state order still exists. And I guess if you could also just talk about beyond the orders, like what is the compassionate thing to do? Like what is the responsible thing to do when we're out and about, thinking about those in our community that are vulnerable and are unable to protect themselves with the vaccine. I think there is a lot of confusion, both what people are supposed to be doing and what is the next thing to be doing.
Well, right now, the state guidelines remain in effect, and the state guidelines indicate that fully vaccinated people outside do not need to wear a face covering, and if you're not vaccinated and you're unable to maintain distance outside, you should be wearing your mask. Now, of course, larger events, the mega events like Anna spoke, they would still want face covering requirements under the current guidance. The indoor requirement to wear face coverings has not changed. Right now, it's still required to wear a face covering indoor, whether you're vaccinated or not, unless you are in a room by yourself. And but if you're in a congregate area with others, a face covering is still required. The CDC guidelines are not in effect in California at this time. However, that could obviously be changing next week. And in regards to, how do we protect those around us who may be more vulnerable and are unable to use the vaccine? I think Dr. Richardson might be able to speak to this better, but again, practicing all of those precautions of not being, not exposing others when you're ill, and using face coverings and good hygiene are all critical. But Dr. Richardson, I think, really could speak better to the medical aspect when you have a child who's unable to be vaccinated but is vulnerable, for example.
Well, first of all, if a person is vulnerable, they should be taking precautions, their personal precautions, and trying to avoid contact with groups. Even though those persons may be fully vaccinated, there have been breakthrough cases that have occurred, and the original guidelines that were set out to control the disease, I think those vulnerable persons should continue to adhere to. Now, having said that, once the disease gets under a good control, in other words, the contagious rate, like the R value, which is the measure of the contagiousness of the disease, reaches less than 1, then the disease in the community would be less likely to be spreading. And are we there yet? Nationally, we're not. Locally, we may be close to an R value of 1, but you can't predict where that number is going to land until time goes on. So that person would still have to be very, very cautious in settings if they're vulnerable and have underlying medical conditions.
Yeah, this person had gone to the grocery store, and there were some folks who weren't wearing a mask, and I guess it just made me think that especially in places like a grocery store, that you really can't avoid. It seems to me to be the responsible thing to do, to just keep wearing the mask for a while till we do get to that point where the risk is extremely low.
Yes.
Okay. Do any other supervisors have any questions or comments? We do have a hand raised from Ms. French to promote Mr. French.
morning. Can you hear me okay?
Yep, go ahead, sir.
There's been a few things happening concerning the virus that I felt like the council should be aware of. The authority and integrity of the CDC is being challenged on the very floors of Congress, as Fauci was confronted by one senator for his involvement in gain-of-function research, both here in the US and in Wuhan, China. The CDC has been under fire since the beginning of the corona outbreak for its continual changing of position and inconsistency of its, quote, science. Now it appears the CDC, the WHO, as well as the Gates Foundation and others will be named in a class action lawsuit for alleged crimes against humanity for these egregious lockdown orders which have caused death and human suffering, and for their push of these dangerous gene therapies being passed off as a vaccine. All this for a pandemic, quote, based on the results from a completely unreliable PCR testing system, which was set to manipulate the number of cases and set our world in an unnecessary panic. To this day, the numbers show that this was never a pandemic, as the average of 99.8% of those under 70 who contract the disease will recover, and possibly making the vaccines unnecessary, especially dangerous and untested ones. So why are we masking, quarantining, shutting the lives and livelihoods of the healthy majority to try to protect a few that are at risk? The at-risk should be quarantined and protected while the rest of America functions just like we've always done. Incentivizing healthy people to take the shot is a joke and unprecedented. The experimental vaccines have produced many adverse effects, including death. Why would we push that on healthy people? Who would like to be the first to volunteer your child or your pregnant daughter? This council cannot continue to govern this county based on the faulty information from highly suspect sources. We can no longer afford to take the guidance, quote, without question from those that may not have our best interests at heart. And we surely cannot risk the health future of our children. As one board member likes to say, which of the people should we sacrifice so the rest can live free? This is faulty logic. Shall we all stop driving our cars because someone might get killed in an accident? Or shall we apply that logic to the experimental vaccine, since there are those that are dying from it? 2 weeks ago, I asked this board for a logical explanation for vaccinating children who have almost no chance of even getting the virus, much less dying from it. The logic was provided. I respectfully call on this council today to stop the vaccination of children and to seriously question the, quote, guidance being fed to it. I also urge this board to end all lockdown mandates, including mask wearing, which, when considering the information we are now getting, are useless measures. Thank you very much.
Thank you for your comment. Is there any other member of the public wishing to make any comment, or any other supervisor with a question or comment for the COVID team? Okay, thanks team for another great report, and thanks for keeping it up this whole time. Appreciate everything. We'll look forward to the magical date of June 15th and see what you have to tell us next week.
Yes.
Thanks, everyone.